let me start by saying that 30 years ago, if somebody were to mention about suffering from cancer, I think at that time I remember vividly myself that the feeling was that it's actually a terminal disease, and therefore it's almost a condition that nobody want to speak about, and they actually want to they are shy away from talking about it. So we have come a long way in terms of the cancer treatment and cancer, what I call the diagnosis and treatment of cancer today, right? So today I'm going to share with you some of the latest development and findings that we have on cancer, and will share with you what are the things that we actually can do in our daily life to reduce the risk of cancer itself. Right. First of all, let's look at some statistics. Okay. So this is one of the latest statistics on global states of cancer incidence. Right. If you look at it itself, right, this chart is actually the global cancer incidence in terms of ranking. A ranking of it is actually based on the age standardized incident rate itself. So the higher the rate, obviously means that the country that is like Australia and New Zealand, in fact, are among the top cancer incidence states itself in the world, right? So actually, this is a very scary thing. And if I look at it itself, I'm a bit surprised that this number itself shows Australia and New Zealand being on the top of it itself. Following Australia and New Zealand, you can see that the blue columns of states, the countries are generally the developed European and Western countries like US, Canada, and Europe itself, right? Now, the Asian country basically follow after that, and actually Japan rank among the highest cancer incidence rate among the Asian countries, followed by South Korea and Singapore. Now, you will notice a trend, put it that way. The more developed the country is, right, in fact, the higher the cancer incidence. So therefore, countries that's less developed, like the Southeast Asian developing country of Philippines, Thailand, Vietnam, Malaysia, Indonesia, you can see that the cancer incidence rates are actually lower. In fact, about 2 times or 3 times lower than those in the top quintile of itself. Right. So it's actually quite a surprise. But I would say that if you analyze this itself, you'll find that then cancer incidents are very highly related to country that's not developed. It could be a lot of factors that's involved. One of the reasons is that the developed countries itself, their medical facilities are much more advanced, and therefore other causes of death and their lives, the causes of death are actually lower, diseases are lower, and therefore end up that the cancer actually, because they live longer as well, because of that itself, and therefore the cancer incidence actually does decreases in there. Now, there's one statistic to share with you, okay? Now, let's look at the second statistics itself, right? What is the Singapore's state of cancer compared with the other cause of death itself? You can see from here, Singapore principal cause of death, cancer is still the major one, although cancer and pneumonia are very closely as a principal cause of death itself, right? Cancer accounts for 25% of the cause of death, right? Followed by pneumonia and followed by ischemic heart diseases itself, right? Okay, right. If we look at it itself, let's ask the question of what's the odds of getting cancer. Actually, cancer is a very fearful and deadly disease itself, right? And there's a lot of studies now, and a lot of statistics show that our lifetime risk of developing cancer actually is quite high. And in fact, this number is a very scary number itself. For Singapore, the lifetime risk of developing cancer For the male, it's about 26.6%, and the female is 25.8%. So average out is about Singaporean have a 26.6% risk of developing a cancer. For the developed countries like Australia, New Zealand itself, the risk of developing cancer in fact is higher. You can see that there is an average of about 30%, right? For the less developed countries like Malaysia, Indonesia, right, Philippines, and so on, basically the risk of developing cancer are lower. They average around 15 to 16%. Right? But this is still a very scary number. Imagine that 25% lifetime risk of developing cancer, which means that every one of us should be concerned about this issue. All right. So if we're looking at cancer, I think the way to look at it is how far have we progressed on cancer treatment, right? So the state of cancer treatment indicates to some extent to us the progress of cancer treatment. And cancer is, in fact, as we all know now, is a term for a wide spectrum of diseases itself. There are many, many types of cancer. And therefore, if you look at it, there are cancers that is actually now considered very deadly still, but there are cancer now that consider actually not deadly. If you look at the 5 years relative cancer survival rate, which is a benchmark reference for cancer performance, cancer treatment performance itself. And the red color represents the Singapore cancer 5-year relative survival rate. The blue one represents the US cancer 5 years relative survival rate. So if you compare the two countries' cancer survival statistics itself, you can see that in general, right, on overall, right, for cancer, actually the US cancer survival is slightly higher than the Singapore cancer survival itself, right? And you can see that which type of cancer here are actually still have very low survival rate. For example, pancreatic cancer is one of the lowest and most deadly cancer still today, right? Followed by esophagus, liver, and bowel cancer, followed by lungs and stomach cancer and ovary cancer. We will be talking about some of this cancer in more specific details and what are the things that we can do to actually mitigate the risk of this cancer itself, particularly those that have very low cancer survival rate itself. There are also now a lot of progress in a lot of cancer that actually are no longer a fearful type of cancer diseases. Cancer of thyroid, prostate, skin cancer, breast cancer, for examples, their 5-year survival rates are very high, which means that even if you're having a prostate cancer or thyroid cancer, basically you should not be too concerned because the state of cancer treatments are actually, the prognosis of the cancer survival patients are very good and very high. Right. Okay. In our approach to develop strategy for cancer prevention, right? Basically, we based on the biology of cancer development. You can see from here the chart here, right? The cancer basically started from either pro-carcinogen, which is actually virus, radiation, or chemicals, or direct carcinogen. These two are the trigger factor that damage our normal cell, and resulting in our normal cell actually having genetically what they call damage. The DNA has been damaged and therefore is transformed into a cell that's immortal. And this is actually the starting of actually what we call the initiated cancer cell, the cell that don't die, the cell, right? So in the concept of cancer prevention, in preventing the initiation of cancer cell, actually we call it the primary prevention of cancer. Basically, the concept, the strategy is to avoid exposure to carcinogen, right? Avoid exposure to viruses, radiation, and toxic chemicals, for instance, right? So when the cancer cell is a cell DNA is very damaged cell, right? what we want to do is to prevent the DNA cell from transforming into a cancer cell, right? So in this case, we are talking about preventing the formation of carcinogen itself, right? So these are actually what we call the prevention stage, early stage of cancer development. And today we're going to talk about is actually a lot focused on actually the primary prevention strategy, as well as actually when the cell is damaged already, right, and you start having characteristics of a cancer cell itself, what are the things we can do to block the cancer cell from progressing into a full-blown cancer cell or lesion itself, right? So, okay, now, so to summarize that, okay, you can look at it itself from actually the earlier chart itself. The whole progression of cancer actually is actually a long progression from a single cell damage to genetic changes, right? DNA damage, and then from there you form a small cell, and from the cell they grow to the cancer cell. And in here, right, what are the strategy, right? So let me summarize what they call the current strategy that based on actually the biology of cancer development, right? The current concepts in the cancer prevention actually is that the first thing is to reduce the cancer risk, right? So what are the factors that can trigger cancer that cause the cell damage is the one that we will start to reduce the cancer. That means basically avoiding those risk factors, right? Second, the concept is actually in using food as medicine. So we will talk about this concept a bit later today, all right? Then the third concept in cancer prevention basically is that we focus on early detection. Where we can detect the cancer cell early, the better chances are for us to deal with it itself, right? Then the fourth concept in cancer prevention basically is that if you have detected cancer, right, then you should seek treatment, right? You should not self-treat. You should seek treatment. There are already available treatment. There are many progress in the cancer treatment itself. Then, of course, once you have suffered cancer and you are in remission, you recover, then you also have to learn to prevent recurrence. So these are the current concepts in cancer prevention itself, right? So let's look at this chart here. This chart here actually basically indicates the top 5 most treatable cancer. Now, what are the top 5 most treatable cancer today? You can see that prostate, thyroid, breast cancer, skin cancer, and uterus cancer. They are all, if you look at it itself, if it's at a localized stage, when the cancer is in the early stage itself, almost survive, almost 100% survival rate, and 5 years rate of survival rate. It's only that when the cancer is already in a distant, which means that it's already metastasized cell, right? Then the survival rate drops itself. So therefore, you can see from here that based on these 5 types of cancer itself, later on you will know from the presentation you'll find out that actually it is actually the advancement in early detection that actually raised our cancer 5 years relative survival rate for this type of cancer. So to those who actually have this type of risk, basically nowadays cancer is no longer a fearful disease because in fact we treat cancer as a chronic disease in our cancer prevention. All right, now, so we talk about cancer prevention. First concept actually is to reduce the cancer risk factor, right? So in fact, if you look at it itself, in fact, in International Agency for Research on Cancer by the WHO itself, basically, in fact, have already sort of stated that cancer is a largely avoidable disease, and they concluded on that. In fact, they concluded that 2/3 of cancer may be prevented through environment and lifestyle modification. Right. So let's look at some of the cancer modifiable factor, the risk factor that can that actually contribute to cancer that are actually affected by the environment and lifestyle, like physical inactivities, right? Infections, diets, UV radiation, which is the sunlight, right? Alcohol consumption, obesity, and cigarette smoking. You can see from here, these are the statistics from US cancer statistics itself, and the attributable modifiable risk factors, cigarette smoking actually is the highest, followed by obesity and alcohol. We'll be talking about this what are the things we can do with this? Okay, and I share with you some of the information on cigarette smoking, obesity, and alcohol risk on cancer. Okay, now when we look at a major cancer risk factor, we look at from the lifestyle, but actually the risk factor varies between the region because the lifestyle itself is different from country to country, right? So therefore, if you look at it from another perspective, whereby we separate between developed countries like US, Western country, Australia, New Zealand, and Singapore, right? Actually, the risk factors, major risk factors for cancer are actually in the diet, right? And followed by actually tobacco, smoking, and followed by infection diseases itself, right? Now, whereas for developing countries, for most of the Southeast Asia countries like Malaysia, even China for that matter, all right? Actually, the major risk factors are not diet. In fact, if you look at it itself, infection causes cancers are one of the major risk factor, and actually followed by diet or nutrition. And tobacco is only the third. Right? So therefore, different countries have different risk factor, and the significance of that is very important because if you are in a developing country, right, your focus should be on the infection risk reduction of cancer and diet inclusion as well. But whereas if you're in the developed countries itself, the country's medical system are better, right, and therefore the risk of infections are actually much lower. In fact, there are a lot of advancement actually in cancer, infectious cause cancer are in vaccination, which I will discuss shortly. All right. So look at one of the major risk factor actually is tobacco. So let's see. So the first advice to everyone, if you want to talk about cancer prevention, tobacco is one of the cancer risk factor. Right? What type of cancer caused by smoking? By smoking, you can see the lung actually for both men and women. Lung is actually the major cancer that caused by tobacco smoking, followed by larynx, esophagus, and pharynx. So basically on actually the upper respiratory organs itself, part itself. It really doesn't matter whether between women and men, they are all the same, right? Now, put it that way. It's very important. And if you look at it itself, I can share with you this table, which is a table for non-small cell lung cancer itself, right? You look at the survival rate for non-small cell lung cancer, which is the most common types of lung cancer, right? The localized stage itself, the survival is only 64%. Even at the localized stage, the survival for the lung cancer is actually at 64%. So if you are at actually a distant, which means it's metastasized, right, your 5-year survival rate is actually dropped to actually below 10%. So it is a very fearful disease for lung cancer. So therefore, tobacco is strongly correlated to lung cancer, and therefore one of the key things, if you look at the cancer statistic itself, lung cancer is actually one of the highest types of cancer in cancer incident, and tobacco smoking contribute a lot to the lung cancer incidence itself. So, and because the age is very, very difficult to treat, therefore, it's more so important that we do the prevention, because once you are having suffer from lung cancer, actually the chances for your survival are very much lower than other types of cancer itself. Okay, now another factor that can affect us actually in the lung cancer actually is not only just tobacco. Actually, you can know that now we know that air pollution also contribute to lung cancer. Now, however, I want to share with everybody here is that actually the major cause of death of air pollution are not actually cancer, lung cancer. If you look at these two charts itself, basically, you look at these two charts itself, actually the major cause of death for air pollution are more of heart diseases itself, like strokes, coronary heart disease, and so on, right? Lung cancer is a cause of it, but then lung cancer is, as I say, cancer is a slow progression diseases itself, whereas heart attack and strokes are very acute incidents itself, right? So important for us to know that actually we are not talking about smoking alone. Anything that we breathe in, for instance, the air itself that we breathe in itself also can contribute to the risk of cancer. So you can see that household air pollution account for 17% of the lung cancer, right? And ambient air pollution, which is indoor, the outdoor air pollution itself account for 14% of lung cancer incidents. All right. Now, another factor that we can control and prevent is our body weight itself. Obesity increases the risk of cancer. Now, in here, I just want to highlight, you look at this two chart itself, man's relative risk of death due to cancer, actually compared with woman relative risk of death due to cancer, due to obesity, right, itself. You can see that the risk factor for overweight is higher and more sensitive to women than the man. Just to let you know. And what are the cancer that's most sensitive to the weight, body weight, especially for women? Cancer of uterus, kidney, cervix, and pancreas and esophagus. Now, gallbladder, esophagus, pancreas are very deadly, are the most deadly form of cancer itself. And the risk factor are actually 2 times twice very high. So women are more susceptible and sensitive to cancer risk when you are overweight, right? Compared with men, you look at itself, the risk factor are lower, right? But for men itself, the major risk factor if you're obese actually is liver cancer risk, right? Followed by pancreatic cancer. These two, again, is also one of the most deadly types of cancer today. Okay, now another risk factor is physical inactivities, right? That means that exercise, whether you exercise or not, right? So in here you can see that again, there is a report from American Cancer Society and say they report that the exercise protect against breast cancer, cancer of the colon, and endometrium, which is uterus cancer itself, right? So you can see that the relative risk reduction in this chart in here, risk reduction on a series of types of cancer from bladder, breast, colorectal, uterus, esophagus, stomach, kidney, and lungs are all actually affected by whether you exercise or you don't exercise yourself, right? And you can see from here, right? Again, same, right? Exercise for women are much more beneficial compared with men because you can see the breast and uterus cancer are actually only for the woman, right? So, of course, all the other cancers are actually common between both sexes itself, right? But generally, physically active for 30 minutes or more most of the day itself actually will help to lower the risk of cancer. And there's a full spectrum of cancer that you can help to reduce itself, especially beneficial for women. Okay, now let's look at from another context. When you talk about exercise, right, we talk about most of us will say that, okay, what type of exercise is more beneficial now? Or let's take walking. Walking is the most common form of exercise itself. So there's another study here by the British Medical Journal, right? So basically in here, you can see that exercise does actually reduce a full spectrum of types of cancer, from colon cancer all the way to liver cancer. So there's a lot of benefits in doing exercise, all right? So then we will talk about, okay, if it's walking, right? Walking itself, there are 2 types of walking. We take an average pace as we walk at maybe about 10 minutes or 1 kilometer is our average pace. So then it helps in 14 types of cancer. But then do I make any difference if I walk faster or walk slower? Basically, you can see from this chart, it say that if you walk faster, you might benefit a certain type of cancer, like cancer of the lung, thyroid, small intestine, liver, and anus. So these are basically some reference points. So of course, as a general guideline, you don't have to really worry about whether I want to walk fast or you want to stop. So if you have exercise, generally it helps to reduce your cancer risk, because actually you cover a very wide spectrum of cancer benefits of all. So physically active is a very important part of cancer prevention activities. Okay, now for those who want to look at more solid number, I mean, you're talking about risk factor and the percentage reduction is about 10, 12, 20%. But let me tell you that, right? Here are some charts showing that for cancer survivor. So that means that you're having a cancer, right? We compare a cancer survivor of colon cancer here, that compare a patient that's actually survived the cancer, colon cancer survivor, that have low physical activities and their what they call colorectal cancer survivor rate compared with having high physical activity. You can see that the one with low physical activity, the survival rate percentage goes up much higher, like 20%. But whereas if you are maintaining your high physical activities, actually your risk is below 5%. So this is a very high 3 to 4-fold reduction in the risk and extend the survival. So it's a very strong proof that actually that if you exercise, even with cancer patient, exercise does help to extend your survivability itself. Right? Remember, right? Colon cancer actually is one of the very treatable cancer nowadays. But then, if you are actually allowing it to metastasize, actually your chances of survival also still drop dramatically. Okay, another example actually is the breast cancer, because colon cancer and breast cancer are the two most common cancer today we find. So you can see the same, that the one with low physical activities, the cancer mortality rate goes up much higher. Whereas if you have high physical activities itself, your mortality rate are actually half that of those low physical activities. So these are very significant factors in cancer survival, even for patients that actually have survived cancer treatment. All right. So another modifiable factor, and this is especially important, especially for those in Australia and New Zealand. I put it that way. All right. Actually, skin cancer is the most treatable cancer in all types of cancer. It's the most preventable because that skin symptoms are very easily detectable and self-diagnosed. You can detect it, you can diagnose it very easily. You can see from here that the 5-year survival rate for localized skin cancer is almost 100%. You don't have problem at all, right? You don't have problem at all. Even if it's regional, your chances are still very good, 25%. So what are the things that you can do to avoid skin cancer? First of all, I think it's the sun factor, the UV factor itself. So first thing is avoid peak radiation. You also know nowadays, a lot of watch, even my Apple Watch also show radiation intensity. So when it's at peak, please avoid it. Right? Stay in the shade, cover exposed area, and very important, don't skim on sunscreen. So Atomy have a lot of sunscreen, right? And I think the Atomy sunscreens are all SPF more than 50, or SPF 50 as a base, which is a good reference, because if you have SPF that's less than 30, you have no effect at all. It's not much of protection effect at all. Now, important, the reason why skin cancer is actually very treatable is because you can detect at very early stage. So these are the symptoms of skin cancer that almost everyone can do some self-diagnosis. Self-awareness of it itself and seek early treatment is almost 100% curable. Okay, another modifiable risk factor actually is on the food, right? Nutrition, as you can see from there, both developed countries and underdeveloped developing countries and developed countries, one of the major risk factors is still nutrition and diet, right? So among them, first of all, we should avoid food that can cause cancer. What are the carcinogenic food? First, food that have fungal growth, especially alpha toxins. These are the fungus that grow in the dry groundnuts, maize, rice, and beans, like this in the picture, right? So what are the cancer they can cause? They can cause liver cancer, cancer of gallbladder, which are very, very deadly types of cancer, all right? Now, another class of food that you should avoid are the char, burnt food, right? So this food contains carcinogenic compound that can cause colon cancer, pancreatic cancer and prostate cancer. So you can see from here that both colon and pancreatic cancer, especially pancreatic cancer, is also a very deadly form of cancer today. And then the third category of carcinogenic food today, I will share with you some detail, is actually the red and processed meat itself. So colon cancer, red and processed meat both have known now to increase the risk of colon cancer, stomach cancer, which is a gastric cancer, and nasopharyngeal cancer itself. And another category of it itself, which is actually very common in the South Asian and East Asian side, especially the Chinese in the Guangdong, southern China's region. Salted fish. I think the Malaysian, Singaporean are familiar with this, including the Thai, right? The diet itself have a lot of preserved food, especially salted fish. And it's known now that the salted fish also can contribute to nasopharyngeal cancer and raise the risk of nasopharyngeal cancer. All right. So these are the food that we should avoid. Known that it's already known that it will cause cancer, and therefore, if it's possible, this should be the first thing we do to avoid taking this type of food. Now, let's look at the diet. Since we talk about diet, it's a major modifiable risk factor, right? So what are the cancer dates that link to diet? So remember, it's a cancer dates that link to diet, not cancer incident, which means that this is a much more serious number itself. You can see from here, right, in this study, right, the cancer date that linked to diet itself, actually colorectal cancer account for about the bulk of it, which is actually 38 to 40%, which means that actually diet and colon cancer are very closely related. So if you want to reduce the risk of colon cancer, focus on your diet. Focus on a diet. Of course, diet also can contribute to breast cancer, esophagus, and stomach itself. But I want to highlight that now, if you look at it itself, there's a strong correlation between colon cancer and diet in terms of cancer risk. Okay, now let's look at the meats that can cause cancer. I mentioned earlier that the red meat and processed meat consumption increase the risk of major cancer. So look at what are the cancer risks that's affected. So breast cancer, uterine cancer, colon cancer, rectal cancer, lung cancer, and liver cancer. So processed meat have affected colon, rectal, and lung, and the breast, whereas red meat is across the spectrum of uterine as well as liver cancer also affected in that. Right, now this is one study. This study actually is a European study on that itself. Right, now another study on red meat, right, itself, right, the risk of the incident of what they call colorectal cancer in Asia. This study is actually on the Asia side itself. You can see that the risk of actually having red meat on colon cancer, rectal cancer is a form of colon cancer. Basically, they are the same. They are under colorectal cancer as a group. So you can see the risks are very much higher than what is stated in the European side. Now, why? Well, I can tell you that maybe one of the factors could be due to the way we cook the meat itself. Right. So therefore, put it that way, right? In the context of it itself, in general, red meats itself actually increase the risk of cancer, and particularly it also have high correlation to the colon cancer risk. Okay. Now, just for some who actually might want to ask, what is red meat? How do you define red meat? There's a lot of maybe ambiguity in what is red meat. I'm going to give you the clinical definition of red meat. Here is a red meat referring to meat from mammalia muscle tissue, which is mammals, which is like beef, pork, lamb, mutton, goats, and deer. These are actually mammals. So meat that come from mammals are considered as red meat in the clinical context. White meat are actually poultry and fish, right? With the exception of one mammal, which is rabbit. It's also considered that itself. So generally, white meat are actually poultry and fish. So therefore, if you look at it in this context, we are referring to all the mammal meats that can increase the risk of cancer. All right, now another one is actually not the meat, but rather a processed food. The processed food that is actually ultra processed, right? That means has been processed with a lot of chemicals, our synthetic chemicals and sweeteners and so on in there. Now, ultra processed food raise colon cancer risk in this study, right? And this is actually a very authoritative study reported by Lancet, Lancet itself. So the risk, actually, what are the ultra processed food that you should be types of ultra processed food here? But the one that is concerned should be the red one generally, as general guideline. So ice cream and sweetened dairy dessert have one of the highest risks for actually colorectal cancer, right? Followed by sweetener, artificial sugar sweetener, beverages, and packed snacks. And then you can look at it down the road here, down this table here. Then the processed meat product actually have a less than 1 hazard ratio, which means that they don't actually have a risk. In fact, they have a reduction in it. Now, very important, I want you to understand in the data here, this context of this table is referring to cancer, colorectal cancer mortality risk. It's not incident risk itself. So therefore, it doesn't mean that a reduction, a negative, less than 1 risk health ratio. Hazard ratio means that you can go ahead and eat processed meat that we mentioned earlier. In fact, processed meat all have been proven to increase the risk of cancer incident. But it might not actually cause death, but it actually does increase. So as a guideline, I'll put it that way, all right? So ultra processed food are bad, right? You want to prevent the risk of cancer, right? Focus on those sweetener, ice cream, sweetened dairy product, right? You once a while you take some processed meat, don't be too worried about that. But then I would say that if you talk about the significance of ultra processed food in terms of correlate to the colon cancer risk, ice cream is the one that you should avoid, and the sweet dairy dessert you should avoid most. Okay, now in talking about so much about colorectal cancer itself, so it's very important that in here I want to interject and tell everybody that, right? So I'm not going to go and cover a lot of things on what are the supplements for what are cancer. It's going to be not really directly sort of relevant, and in fact, it's you will understand later that why I say so. But there is one supplement that's very helpful for colorectal cancer prevention and prognosis, right? That is actually probiotics itself, right? Now, the reason is that probiotics actually are able to restore your gut dysbiosis, able to regulate the intestinal immune system, and prevent pathogen from invasion. And all this itself basically prevent the formation of polyps in the colorectal cancer in the process itself. So therefore, it's really known, we know that probiotic actually helps prevent colorectal cancer. So for people who have colorectal cancer risk, or actually taking, put it that way, if you take probiotics, it's actually generally a good supplement, especially for prevention of GI-related cancer itself. All right. Now, another cancer modifiable risk factor is the alcohol. We talk about alcohol, right? So you can look at it itself, right? Alcohol can cause what type of cancer? Alcohol cause oral and pharynx cancer, esophagus cancer, throat cancer, liver cancer, breast cancer, and colorectal cancer as well, right? In fact, with actually the esophagus and oral cancer have one of the highest risk of cancer risk if you are heavy alcohol drinker. Now, here, right, I think I want to highlight that everyone is that a lot of us drink alcohol. Drinking alcohol in moderation is not that bad. You can see from here that light drinking are the blue bar. Generally, their risks are relatively close to 1, which is actually not much of a risk. So you can drink in moderation and light, right? Moderation itself, you increase your risk of oral and esophagus cancer. So I want to highlight here is that alcohol, the cancer that you're most concerned actually is what cancer? It's actually esophagus cancer. Now, if you look at this chart here, esophagus cancer, the 5-year survival rate for localized esophagus cancer is less than 50%. Esophagus cancer is one of the most deadly cancer, very much second in the rank of following closely related following from pancreatic cancer itself. They are very, very deadly. You will look at it itself, the overall 5-year survival rate of combined all stages is actually 22%. It's one of the lowest cancer survival rate types of cancer. And therefore, if you talk about alcohol consumption, why you should be concerned about it is because the risk of esophagus cancer is the main concern, right? Main concern. So first of all, right, you look at it, 95% of cancer cases are down to alcohol, right? Alcohol increases the risk of 7 types of cancer here, right? And alcohol also can contribute to weight gain, a risk factor for at least 13 types of cancer. So if you can, right, moderation and limit your alcohol consumption. This is also one of the cancer prevention tips. Okay, let's look at the infection. Now, as you know, infection actually account for major risk factor in developing country, right? The healthcare facilities are poorer, right? Are less established itself. Now, look at what are the types of cancer that can caused by infection agent. Right? You can see from here, stomach cancer actually account for one of the major cancer that's attributed to infection. Followed by liver cancer, followed by cervical cancer. So we're going to talk about this itself. Now, what are the agent? What are the infection agent that's causing this itself? You can see that the stomach cancer, the main infection agent is a bacteria, Helicobacter pylori, which is a bacteria itself. In short, we call H. pylori itself. Then the liver side is actually hepatitis virus. It's a virus that causing the liver cancer, right? Then you have the cervix cancer. It's actually, we call it human papillomavirus. Actually, it's a HPV in short itself. So we will be covering this infection causes cancer. Okay, now let's talk about H. pylori infection itself. Right. Now, the problem with H. pylori infection is that actually H. pylori infection is very widespread. Widespread. Actually, it might be present in more than 50% of the people in the world. This is a report according to scientific reports itself. So it's a very widespread. 50% of people actually is infected with H. pylori. So, and how do you infect us? Actually, H. pylori infects your stomach, and it usually happens during your childhood. The problem is that it started early, so you have no clue of it. It's already in your body already. This is a very common cause of stomach ulcer. So when you have ulcer, the first thing you check for is whether you're infected with H. pylori itself, right? So how do it pass? Actually, they are passed on usually from person to person through direct contact with saliva, vomit, or stool. In Asian practice in the past, I think that if you share common utensils itself, this is actually the main direct form of passing of H. pylori. Is where you can see that in countries like China, in Taiwan, in the past, and even in Malaysia, right? We experience very high H. H. pylori infection rate. Is because that the way we eat, we share common eating utensil together, and therefore it is the bacteria is passed. The bacteria is passed through the saliva itself, right? Of course, it can also spread through contaminated food or water, right? Now, the most common symptom for H. pylori infection actually is the burning stomach pain. So you can see, of course, people who suffer from ulcer also actually have the similar symptom. Okay, so let's look at the H. pylori infection itself. Now, H. pylori infection is a strong risk factor for stomach cancer. Now, how does it progress? You start from a syndromic gastritis, right? Then you have followed by gastritis. Then you have ulcer. This is the ulcer at the later stage. Then, if it's not treated further, actually 1% of it itself will probably transform and progress into gastric cancer. Now, how deadly is gastric cancer? Let me put it that way. You look at this chart, right? The 5-year survival rate for all stages of cancer, gastric cancer is 36%, which is also a very scary number, which means that if you are having gastric cancer, right, your chances of survival actually are very low, less than 50%. You're only 36%. And even if it's localized, right, the chances of it is only 76%, far from what we call the 90 or 95% itself, right? Now, so the H. pylori infection is associated with about 60% of duodenal ulcer and 40% of gastric ulcer, right? So both are actually ulcer of the stomach itself, okay? Right, and if you look at it, there's a report, and in fact, why China have the world number one stomach cancer incident in China is because H. pylori infection actually is very rampant in China itself. In fact, there's a study that confirmed that H. pylori causes 90% of stomach cancer, which half of it occur in China alone itself. Okay, now another thing I want to say is that the probiotic is another great supplementation in this case, right? Probiotic is effective in the treatment and the prevention of H. pylori. So this is actually one of the very strong evidence now on a latest study, right? It's a systemic review and meta-analysis itself, which concluded that probiotic actually is effective. Right? So it can be used in treatment. At the same time, you can use in the prevention of H. pylori. So if you are suffering from stomach ulcer, it benefits you from taking probiotic itself. In fact, probiotic is being used in combination with the what they call H. pylori eradication therapy by combining with antibiotics intake itself. Right? So as far as concerned, these are all the studies and reports relating to probiotic as an adjunctive in medication in treatment of H. pylori. I'll leave it for you to have self-reference itself. But just to say, probiotic is also a very effective adjunctive therapeutic for H. pylori infection, which means that it's a very good supplement you can use for prevention of stomach cancer. All right, now cancer that caused by virus itself, I mentioned that other infectious disease like cancer, like liver cancer, basically they are caused by hepatitis B and C virus itself, right? And the HPV virus itself basically causes quite a spectrum of cancer, mainly the cancer of your anus, the sexual organs, cervical cancer, penis, throat, vagina, and vulva cancer itself. Now, fortunately, right, for the cancer prevention, these types of virus, the hepatitis virus and HPV virus itself, can be prevented by vaccination. So that means that you actually can vaccinate to prevent the hepatitis as well as HPV. Unfortunately, there's a wide type of virus that there's no vaccine at this moment, which actually the virus is EBV. So this virus itself actually is a very common virus that's also very widespread virus. It's actually very common in all. In fact, almost everyone is affected in some form of this virus. In fact, there's a study who say that, right? Now, this virus causes what they call the link to the risk of lymphoma and nasopharyngeal. Right? So lymphoma is not so deadly, but the nasopharyngeal is actually a very deadly cancer still. All right. Now, currently, there's no vaccine to deal with these types of virus infection. In fact, the only option we have in cancer prevention actually is to enhance our body's natural immunity. Okay, now let's look at the liver cancer side. Liver cancer is one of the deadly cancer. You can see from here, the 5-year survival of a combined stages is only 22%. So now, how does liver cancer progress? Actually, once you are infected with hepatitis itself, you actually, if you don't treat it itself, right, you will progress to cirrhosis. And from cirrhosis, if you still do not control it, right, contain it, actually 2 to 7% of it itself per year will actually will become cancerous cell. So we call it liver cancer, right? So important. First thing in the cancer prevention, especially for liver cancer, a deadly cancer like liver cancer, is to vaccinate, right? And fortunately, a lot of country vaccination is almost compulsory in the early stage of the childhood already, right? So do remember to vaccinate to avoid hepatitis infection, and hepatitis infections vaccination should help to eliminate the risk of actually the hepatitis cause liver cancer. And that's why you can see that the liver cancer incidence in the developed countries side itself actually are quite low, primarily because of vaccination. Okay, another vaccination that is important, and in fact, I think in Singapore, it's already in the early stage already. The kids already given the vaccination on HPV infection, vaccination itself, right? So you can see that the HPV infection virus actually affects all these types of cancer, especially anus and cervical cancer. Right? You can see from here that almost 91% of cervical cancer and anus cancer are caused by these types of virus itself. And Virginia cancer and vulvar cancer, penis cancer also have high correlations with actually this virus infection. So it's very important, right? First of all, that to prevent this itself, you go get vaccinated. Second thing is that you actually prevent have safe sex practice itself. Sexual transmission is one of the means of infection spreading. Okay, now another key concept that developed over the years is actually cancer screening. All right. Now we know from the cancer biology itself, the cancer takes a long time to grow from one cell to cancerous cell, from one cancerous cell to many what they call a tumor, and from tumor then it spread itself. So it takes many years to actually develop a cancer, basically, right? Now you can see from here that in the US statistics itself, the cancer incidence rates by age, chances are that you will start seeing you see the cancer incidence start increases from age 35 and peak at about between 65. 65, that is actually where the peak is incidence. Then you drop after when you're 75 and lower itself. So this is actually a typical what you call cancer incidence rate by age itself. So very similar. Singapore have a very similar types of profile itself. Now, the concept of actually cancer screening is that first of all, it aims to find cancer before symptoms appear. Right? And therefore, cancer obviously is easier to treat and cure when found early, right? So screening decreases the chance of dying from cancer. That means that actually screening is early detection, and therefore you can treat better, right? So the screening should include for everybody the mouth, skin, colon, rectum, because these are the area where you have cancer, you can visually screen it and check it very easily, right? And then for the woman, you should check for the breast and cervical. And then for the man, for prostate and testing. Okay. Now, when we should start screening, cancer screening? Well, if you look at this profile is here, it's quite obvious that we should start screening at 35. So it is recommended that above 35 years old, we screen every 2 years. Every 2 years, we should start a cancer screening. Right. Now, when you are above 45 years, you should be screened annually, because this is going to be going into the what they call the peak of the cancer incidence period, right? So it's very important screening, because screening play a key role now in the modern cancer prevention, because you actually detect early, you treat early, you actually save life. Okay. Now, so why is it important? You look at it itself, this chart I share with you is very important. Is that this is typically how the cancer progress, right? From one cell, right, to a tumor, to 1 cm size is like it takes about 12 years. That means that from a cancerous cell that's DNA damaged and mutated itself, right, to form 1 cm of tumor, right, it takes about 12 years to reach that stage, right? But from 1 cm tumor, right, when you metastasize, that means that from the primary site or organ site itself, it start to move to other side of the body, right? It takes 31 months. The same tumor, you move to other part, right? Now, it takes only 30 days for the tumor to actually move to a secondary location. But it takes less than 30 days for it to spread throughout the body. Because by the time, right, the amount of cancer cell in the body is already a lot. And therefore, the multiplication is going to be very rapid. So you look at from this cancer growth life itself, right? Actually, it's very important that we try to detect cancer early, because when we detect cancer early, we have a lot of time to detect cancer. Basically, it takes 12 years for cancer to develop to 1 cm of tumor itself. So therefore, it's important that you can see from here that all this cancer in this chart here, the highly treatable cancer, right, if detect early, are the prostate, thyroid, breast, skin, uterus, ovary, colorectal, cervix cancer. These are early detection itself. When it's localized, your chances of survival are above 90%. So therefore, you can see from here that prostate, thyroid, breast, skin, uterus, right, cancer itself. So you can say that these are almost cancer that is treatable if you are able to screen and detect it early. And therefore, this is actually how we can see that part of the cancer progression is not in the medicine that's actually treating the cancer, but more important actually is that in having early detection too, that we can detect early, therefore we can treat it much earlier. So let's look at the colorectal cancer as an example itself. Colorectal cancer itself, it takes about 30 years for a healthy colon to develop a polyp. We all know polyp. Polyp is actually a growth, the abnormal growth in the colon itself, right? And it takes about 10 to 20 years for the polyp to actually become cancerous cell, lump, tumor, lump in there. So actually, in the colon cancer, actually treatment itself, the focus actually is on cancer early detection. We actually talk about screening for colon cancer is actually to detect the presence of polyp or actually early types of cancerous cell that's in the colon itself. So this is actually the most strong evidence of preventing cancer is actually using actually an early detection technique rather than treatment of cancer itself. Right. So how do we actually prevent the cancer from forming? Basically, you know, nowadays most of us will probably be familiar. The colonoscopy is actually the standard, golden standard for actually colorectal cancer screening. As the scope go through it itself, if the doctor see there's a polyp, basically they clip away, and therefore actually serve as the purpose of actually removing the cancerous ridge itself. Now, so when do we need to start colon cancer screening? Now, if you look at this chart itself, then you will understand that you should have colon screening, all right, before 45 years old, because it takes about 30 years to actually form a polyp. So therefore, if you are 45 years old, you should have time to actually look at it and have a detection of it itself, right? So there's a study you show that if you are before 45, you can go for colonoscopy, you can lower the risk of colorectal cancer by 63%. And if you are before 50, you can have a colonoscopy, you actually can lower the risk by 57%. So this is one of the key factors today for the success of a high survival rate of colon cancer is because of colonoscopy and because of early detection, that technique that we have. You can see from here, right? So if it's localized, right, if it's at this stage itself, right, the early detection of it itself, the colonoscopy itself, your survival is 91%. So this is a very curable condition if you can detect it at this stage itself. Okay, now another concept in cancer prevention actually is know your family history. Basically, we are referring to mutation and genetic mutation or inherited mutation, right? So what are the types of cancer that actually have risk of inherited mutation? Ovarian cancer actually have the highest one, followed by stomach, breast, prostate, lung, and glioma, which is a brain cancer, a type of brain cancer, head and neck, and uterus, glioblastoma, all right? So also is a brain cancer, and lymphoma. So if we look at it itself, actually ovarian cancer, stomach cancer, and breast cancer are the very common types of cancer that have some have a high risk and correlated to inherited mutation itself. Right. Here another chart itself, basically referring to the actually BRCA gene, which is actually the breast cancer gene, a gene that is actually in a woman. If you have this gene mutation for breast cancer, you can see from here, by the time of age of 70, your risk of actually cancer, breast cancer risk is actually 87%. It's almost there, almost certain, right? So ovarian cancer, again, same, if you have this gene mutation, your risk of ovarian cancer is up to 63% compared with our mutation. So therefore, a genetic screening are also part of actually modern cancer screening itself. Okay, now cancer prevention also call for cancer cell awareness, right? So we should be aware of cancer risk, right? So who are at high risk itself? First, as we mentioned, those who have family history of hereditary cancer, right? Another one actually is that the medical condition. Now, as we mentioned, the medical condition very often are due to the infection disease. Crohn's disease, ulcers, these are basically related to some extent to H. pylori infections, right? If you suffer from a HPV infection, then you will have a risk of cancer, as we know, right? Hepatitis B or C infection, same thing. You will also have a risk of liver cancer, right? So therefore, medical conditions also carry a higher risk for people who are suffering from cancer, right? Tobacco smoker, we know, actually correlate to high cancer risk as well. And of course, cancer survival itself actually have a high risk of recurrent cancer for a lot of type of cancer that is actually have a recurrent risk. Okay, now in terms of cancer awareness itself, right? Actually, it's good to know the possible sign of cancer, no matter what your age or health. It doesn't matter, right? These are warning signs. It doesn't mean that it's a cancer, but at least it trigger you to actually seek for medical checkup, to screening, to confirm whether, or to what they call, to identify and basically to check whether there is a cancer or benign condition itself. Now, what are the warning symptoms? Sudden weight loss, right? You actually can affect all types of cancer. There have a lot of cancer actually have a symptom of sudden weight loss, right? If you are coughing, especially nagging cough, then you have a cancer risk of lung, right? You are bloating and you have fatigue and back pain coupled with bloating itself. You have a risk of GI cancer, which is type cancer from actually gastric to colon to pancreatic cancer and so on. Now, if you have heartburn or indigestion, then these are actually risk of gastric cancer. When you have problem when you pee, of course, this related to the bladder and kidney, right? And if you have stool that's bloody, then related to colon cancer risk. If you have trouble swallowing, it's esophagus. The mouth sore that don't heal, oral cancer. And you have swollen lymph nodes, actually lymphoma and leukemia. And then you have fever that don't go away, especially low-grade fever, right? Then these are also typical risk symptoms of leukemia and lymphoma as well. So anyway, it's important to recognize that if you are having this type of symptom, go for a checkup to exclude the cancer risk. Okay, now diet, right? So we talk about cancer, and then there's a lot of people asking for, is there a cancer avoidance food, right? So the fact is that we all know, no single food can prevent cancer. But the right combination of food may help to make a difference, right? So basically, I'll show you why, right? Generally, a dietary recommendation for a healthy diet for cancer prevention, right, is eat a variety of healthy food, right? Especially abundance of plant-based source food, right? And cut down on the red meat that we mentioned, right? And avoid processed meat if possible, and processed food as well, right? Now, let's look at it itself, right? Dietary fiber helps prevent cancer. So there's a study, in fact, there's a lot of study associating with plant-based diet and the risk of cancer itself. So the first one is that actually a plant-based diet itself, a key study talking about reducing the cancer mortality by 18%, right? That means that if you eat plant-based diet itself, your cancer risk actually can be reduced by 18%. Cancer death risk itself. Another study, actually by JAMA itself, right? Actually referring to now the GI cancer and gastric cancer. And it's very significant in a sense that it actually can reduce the risk by up to 50% of the GI cancer risk itself. So if you have a concern about your GI cancer, which is gastrointestinal cancer, cancer of the liver, cancer of the pancreas, cancer of the colorectal and the stomach itself, right? Then I would say that the plant-based diet should be your recommended nutritional dietary lifestyle. Should be your first choice of itself. Now, very important, I want to mention here is that gastric cancer, again, is also one of the very deadly cancer. You can see from here that the all stages, 5-year survival of gastric cancer, all stages, is only 36%. This is only about one-third of the 100%, 36% is very low. So localized itself, even its localized form, early detection, is only 76%. So prevention is actually more key in the case of gastric cancer. So therefore, having a plant-based diet does help. Okay, now the core of what we are talking about is food as medicine. The concept of food and medicine lies in actually the way we actually look at how to prevent cancer. You can see from here, the cancer actually, we start from cancer in terms of avoiding exposure. That means preventing ourselves from damage itself. So therefore, we avoid food carcinogen, we avoid infection by vaccination and so on itself, right? And basically, we also actually focus on healthy diet, don't eat food that is actually have toxin, and have a healthy lifestyle, exercise. These are actually the modality that can help us to prevent the formation of cancer. Now, in terms of the cancer prevention itself, preventing the cancer cell from damage itself, right? From DNA damage itself, one of the concepts actually is our dietary chemoprevention, right? What we mean by that is that actually we are, in order to maintain our cell at optimum health itself, right? We should focus on preventing ourselves from damage, right? So in this itself, the cell damage mechanisms are antioxidation, anti-inflammation. So this is actually, in fact, the core of actually food as medicine in our cancer prevention. So what we're going to talk about actually is that we will use functional food and supplement which have strong antioxidation, anti-inflammation function, right, to help us to prevent the cell from damage. And actually, in doing so, we prevent cancer formation. So this is the core concept of it. So what we are doing is that when we take supplementation, actually supplementations are not there to help us to cure cancer or treat cancer, but rather supplementation serve a very important role in preventing our healthy cell from being damaged from being actually triggered to become triggered and damage become cancerous cell itself, right? So let's look at antioxidants compound, which we consider as a cancer avoidance food. So in here, what are the food and supplementation that have strong protective property function for our cell itself? In here, I listed all the more potent one. They are compound like azacitidine, curcumin, quercetin, vitamin E, resveratrol, green tea extract, EGCG. This is a compound that's present in green tea, vitamin D, zinc, and selenium. These are a compound that actually have exhibit strong antioxidant property, right? And basically what they do, they serve to prevent DNA damage of our cell and therefore serve the function of preventing the cancer. So in here is at this stage that all these antioxidant dietary compound works on. They're preventing all this damage and actually making sure that the cell will not be initiated as a cancerous cell. Now here I'm going to talk about vitamin D. It's very important because vitamin D have a lot of function that actually for people who have cancer risk should be aware of. Now vitamin D actually is a very, it's already a well-studied compound that actually have shown therapeutic value and benefits for breast cancer patients. But in here, you can see from here that the breast cancer risk drop as your vitamin D amount in the body, in the blood go up, your risk go down itself. Now these are all the study. I would want to bore you with it, but basically put it that way, right? Low vitamin D status is a risk, in particular for cancer of colon, prostate, breast, and leukocyte, which is leukemia. So therefore, people who are actually having a risk of colon, prostate, and breast cancer, especially leukemia, should actually encourage to actually supplement with vitamin D. It's a known proven supplementation that can help to reduce risk of cancer for this patient. All right. Another one group of it is actually what they call the anti-inflammatory compound, which is also served in here category here, actually as preventing the cell damage and initiation, right? So basically, here you can see that omega-3 fatty acid, which is our fish oil, is one of the favorite and popular compound that have been well studied, followed by curcumin again, berberine, and other TCM compound, resveratrol, again green tea, EGCG, ginger extract, ginger compound. Actually, these are the gingerol. Actually, is the active ingredient in ginger, right? Garlic acid, which is actually active ingredient found in fermented tea, noni juice. So you can see that they are also quite list of supplement that actually are found in Tommy's profile, like omega-3, like green tea, and your garlic acid, which is your pu cha, and the noni juice itself. They are fall under this category of actually strong, potent anti-inflammatory supplement, right? So therefore, they also serve as a very valuable function in preventing the cell damage. So we're going to talk about omega-3, just to pick up on omega-3, because omega-3 actually is a very useful supplement, especially for breast cancer prevention, right? So it's well studied in the sense that actually omega-3 has been well studied and has been proven that it can actually serve as a reduced risk of cancer, in a lot of cancer, including breast cancer particularly, and also it can use as a treatment adjuvant in breast cancer, and it also very useful. It can help to extend the cancer survival of breast cancer patient. So these are all the study and the reference. I leave it to you to actually cross-reference in the chat. But basically, omega-3 fatty acid is a very useful anti-inflammatory compound for cancer prevention. All right, now short note for everybody, right? Just to say that now let's look at the coffee. We talk about a lot of compound, but how about coffee? A lot of people actually not concerned because coffee nowadays is a very common drink, and if you are having cancer or you're suffering from cancer, should I or should not I drink coffee? Right? Now, I put it away, okay? The answer is both depends. Depends on what type of cancer risk you are having, right? You can see from here, the one in the blue bar here, all those cancer that actually are benefited from drinking coffee, especially the liver cancer side, actually they show a very, what they call risk reduction of drinking coffee, right? Whereas on the red bar, red column here, right, are those types of cancer that's actually should not drink coffee itself. So they are the one that like prostate, lymphoma, pancreatic cancer, ovarian, lung, bladder. Drinking coffee might increase the risk, right? So the answer actually is that now if you look at it itself, and for a healthy person like us, if you are healthy, basically you don't know what type of cancer risk you are having. And basically, I'll put it away. Just to put it in the context, the right context for us is that drinking coffee in moderation is generally risk-free for everybody. So even if you have sort of concern about whether drinking coffee increase risk or not, my answer is that generally in moderation, there's really not much of a risk concern on that. But don't drink excessively, okay? Because drinking excessive coffee might increase other problem and have other problems itself. But as a whole, right, really is that in the context of actually our dietary guideline, drinking coffee in moderation doesn't affect any of the cancer risk. If you put it in, look at this page itself. Okay, now atomic product, right? Because I've covered a lot of ground, and I'm going to just summarize this itself. These are the 4 types of atomic product that for people who have concern and you would think that it will be beneficial for them to consume to reduce the cancer risk. As I mentioned, right, their functions are all stated in the pharmacology here. You can see from there that for instance, pomegranate itself have some anti-cancer function, right? Pu'er tea also have anti-cancer function. Green tea also have some anti-cancer function, right? And nori juice have actually antimicrobial, antiviral, immune modulating, and all that. All these are actually also anti-cancer function, but they are not meant to treat cancer. They are meant to actually serve as a very healthy early stage supplementation for people who are actually want to consider living a healthy lifestyle. So a cancer patient, if you say cancer patient, can they take? Yes, the answer is yes. Generally, these are more beneficial than any other thing because they are generally carry anti-inflammatory, antioxidants property, which is beneficial for cancer patient. But remember, these are supplementation. They are not there to help to treat or cure any cancer, but they are here as an adjuvant and as a healthy adjuvant to your diet. Okay, now I mentioned probiotic. In fact, probiotic has been mentioned in specificity because it benefits gastric cancer patient, right? It also benefits colon cancer patient itself. So therefore, it's important that to recognize that probiotic actually is one of the very key anti-cancer supplementation that anyone who have cancer concern should actually try to take supplementation with probiotic. So Atomy have 2 types of probiotic. One actually is a lower strength, 3 billion CFU in powder form, in sachet, right? But this form have more wide spectrum of the probiotic strain, right? 13 strain itself. That means that it cover a more general profile or spectrum of application. Whereas a more high potency Atomy SCI actually is 10 billion CFU per capsule, right? You have 8 strain, it's still not that bad, right? But actually, it's because it's high strength, we generally use for therapeutic and adjuvant application, especially for those who have GI concern. All right. So here I will briefly go through. Right. For the powder form, basically is used for general health maintenance, indigestion, diarrhea, eczema, and gestational diabetic patient. Right. For the SCI itself, basically is used for much more stronger and more critical condition, right? Especially colorectal carcinoma, right? Which colon cancer patient, you can use it as a adjuvant supplementation. GERD, H. pylori infection eradication, right? IBD and so on. So you can see from here that basically if you have a more serious condition, then you should use a stronger probiotic as a supplementation. Okay, I will skip this part. Anyway, I will pass on the PDF file for you all to download. Now you can read from there, and then if there's any question, you all can ask me. I will pass the time over to Pauline now.